Hi, I'm Andrea Leonard. I am a 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. And I just wanted to take this quick moment and talk about a few things when you are working with somebody recovering from breast cancer surgery and reconstruction. One of the most common side effects that we see is upper cross syndromes. We have forward head, rounded shoulders, and perhaps some kyphosis. And a lot of it has to do with tight or spastic pectoral muscles following surgery or radiation. And the patient will probably complain that they have a good deal of pain. Oftentimes that pain is a direct result of lack of blood flow to the area. So stretching the chest muscles out and strengthening the opposing back muscles and scapular stabilizers is critical in exercise programming. However, if they've had lymph nodes removed or irradiated in the chest wall or in their armpit, then they are at risk for upper extremity lymphedema, and that is the swelling of, it can be in the chest, in the lat area, and in the affected arm and shoulder down to the hand. And it can become a chronic and permanent condition. So proper education for the patient about how to prevent lymphedema and incorporating lymphatic drainage exercises is going to be a critical component also of the exercise programming. So I like to always recommend that the client begins with a 5-minute cardiovascular warm-up, just enough to get their body ready for exercise. Then they do their lymphatic drainage exercises. Then before we do any strength training, even if we know that that is part of the prescription, if you will, we must be assured that they have complete range of motion in the affected shoulder, and both sides for that matter, prior to placing a load on that limb. So we want to check flexion, extension, abduction, internal and external rotation, which also may be affected by the surgery and radiation treatment. So as a cancer exercise specialist, when you do your initial assessment, you're going to want to do a complete, comprehensive postural assessment, as well as use a goniometer to measure both shoulders and compare range of motion on both sides. Then ask certain questions. For example, if your client has undergone chemotherapy, do they have neuropathy, which is burning, tingling, numbness in the hands or the feet? And that will also play a role in the exercise prescription, because if it's in their feet, one, they may have issues with balance. So while we want to work on balance training, we want to make sure that they don't get hurt. And if they have it in their hands or fingers, then they may not be able to hold on to a weight or a band, and it could pose a danger to both you and them, because they have a lack of sensation in their fingers sometimes. So I can't emphasize enough how important it is to get comprehensive training prior to working with any cancer patient or survivor, whether they're going through treatment or whether they're 5 years or 10 years out. And I look forward to bringing the cancer exercise specialist programming to Asia, and I hope that you will take advantage of our live workshops and home study courses. You can learn more at ceti.teachable.com.